Thank you. Good evening, everybody. I'm really happy to be here, and I need to live up to what was just said. So let's see whether I got an answer to this burning question of how the healthcare system might be looking in a number of years. I'll be talking about why we need to empower patients. When I started medical school, I hung out with a guy who said medicine would be so great if it wasn't for the freaky patients. This guy eventually became a pathologist, so this is where he's doing his job now. For me, the question is always, oftentimes physicians don't really mend the patient, they mend the disease. They think the patient is second best to what the physician needs to consider. But on the other hand, we need to ask the patient, what's your preference? What do you really want? Do you prefer a shorter time of life with a higher quality of living, or a longer time of life with a lower quality of living? For me, the question is, what is beneficial for the patient? What do patients want? What is an innovation in medicine, really, and where do these innovations come from? Let me take you on a journey for the next couple of minutes to see what we found out with the Healthcare Futurists. This is the Healthcare Futurist. This is an independent think tank of people dwelling in the medical system and thinking about what can we do with the patients? How is the medical system going to evolve? And I reckon by heart, pretty much everybody here in this room is also somewhat a healthcare futurist, because you all, once in a time, make up your mind how healthcare is going to look like for you. So what we do with the healthcare futurists is oftentimes we engage in healthcare hackathons. This is where we bring people together from different walks of life who have no idea about healthcare, who come in with unleashed thoughts. And there's one thing that we found out. Democratization is really key. Its involvement, and its unconditional involvement of people in healthcare. And Leipzig has been crucial in democratization 2 times in the German history. One time was at the Battle of People, which was led more than 200 years ago, exactly 202 years ago, in October 1830, where the alliance of people fought off Napoleon in order to seek their freedom. And the monument is just 1 kilometer down the road. The other one was in 1989, when people took to the streets and when they started campaigning against the former communist government in Eastern Germany. And they brought about democratization. So let's look into democratization in other fields. So there's eBay, and eBay democratized commerce. There's, of course, Apple. Apple democratized computers and music, if you think of iTunes Store, for instance. And there's Google, who democratized information. There are other companies who did democratization. Smart democratized parking. But the question to me is, who is actually going to democratize healthcare? We don't know who that's going to be. We have no major player here. But an ever-growing number of people is engaging in healthcare-related topics. So people are wearing wearables, are talking back to their physicians. They want to understand what's really going on with their body and with their healthcare. And there's a dissociation happening. Healthcare had always been the realm of the few. It's been a religious-like thing where physicians spoke in Latin with the patient, and the patient wouldn't really understand this. So oftentimes patients would give, or physicians would give, the opinions to the patients rather than the other way around. This is where we think needs and change has to come about. And this change we will see in change of lifestyle. So let's look at where we come from, then and now. We gain salvation not from different direction. It comes secured through insurance rather than prayer. So we believe more in the Red Cross for our salvation than we do in the religious realms. If we bend our knees, it's more for diabetes prevention than for devotion. And we do this in the gym. So the gym might be our next best cathedral. In order to stay in sync, we don't resort to the gospel, we resort to our iPhones, which is putting us in sync with pretty much everywhere around us and within ourselves. And we build clinics rather than cathedrals. So this is what we probably believing to our past, to our future. And ultimately, we worship not a divine principle, which we worship in a church. We worship ourselves, which is in the bathroom, which is the room of seclusion and where we can stand to ourselves. Now, let's take on the challenge and let's look a little further what we did with the Healthcare Futurists. Where does healthcare actually happen? If you look into the high altar, the triptychon, the shrine, if you will, of devotion, these days have gone. This is our shrine of devotion, and we devote to ourselves, and we choose which kind of training and which kind of food we are going to intake, rather than where we spend our day with prayer. So this is what we call the I shrine. We just took it to the next level in thinking, and the I shrine is, it's somewhat like Snow White's mirror on steroids. It's the cockpit, the healthcare or the care cockpit for the empowered patient or for the empowered person. So this is a fully featured bathroom mirror that has the iPad technology installed, and you can measure your wearables. You can feed in your wearable data into that. It will be received on the back end in a medical chart. You get your pills dispensed there, you get your pills refilled there, and of course you always have an uplink to a physician. So this is basically the one thing that fits you all. And the tendency of the physician is to not really like that, because the German word Arzt has an etymologic background in arch, which means the beginning of it all. So you find it in archbishop or archangel. So the physician, the Arzt, is somebody who can do pretty much everything. And now with the patient taking power to their own, we look at the decline of the superhero being the physician. So with the physician, they form a somewhat unholy trinity that I like to elude here. So we look at the pharmacist, and the pharmacist is pretty much looking into keeping things the same as they have always been. And there's the payer, the insurance companies, the sick funds, who are rather pushing and squeezing back on money and funds. And in between, there's the physician, not really knowing what to do. A Christ-like figure lost between funds and money and pressure, science and research. And as in the gospel it says, doctor, cure yourself right here. So we need to look into whatever we can do as an ailment for the healthcare system. One part is people start looking into big data. People, or our brains, are organs that tend to search for sense. So we bring things together because we need things in our life to make sense. Big data is something like that. We have the perception, the more data we generate, the likelier it's going to be for us to generate patterns. And from these patterns, we will be able to deduct predictive medicine. And I will come to that in a second. The point here is that big data and the Internet of Things is going to lead to health literacy. Health literacy is comparable to what happened in the 15th century when Gutenberg started printing books and Luther translated the Bible. People took to reading the Bible themselves, and they rather did not rely on a priest's interpretation of their faith and belief. So we are looking into a new reformation. This is why I say here, viva la reformation. And we'll see where this is going to lead us. I've been working as a transplant surgeon, and the point in transplant surgery was always a scarcity of organs. Now, with big data, We might be looking into data donation in order to provide a vast pool of anonymously collected data to predict healthcare and medicine. So what's probably going to happen to the Empower patient is what's right now also happening at Amazon. You buy a book, and the program tells you people who like that book also liked this or that book. So maybe at a very close time in the future, we will be looking into, oh, you had this disease. Well, people who had also this disease in your genetic setup were likely susceptible for this or that other disease. You might be still laughing, but we are already on the verge of facing this reality. So consider data donation a humankind act as organ donation. Let me sum up this. We are now in the world of prescriptive medicine. So you see a physician, the physician writes a prescription for you, you take the prescription to the pharmacist, and you get whatever the physician thought is good for you. This is rather eminence-based. Not a lot of things in healthcare are really evidence-based, even though healthcare presents to be, to some extent, evidence-based. We will be looking further into participative medicine, when patients engage with their physician. And this is the engagement-based physician. You will be speaking with your physician about your disease, whether it's a chronic disease or an acute disease, and you will be drawing informed, consensed decisions on how to proceed with your healthcare. We will be further going into preventive medicine. The part about preventive medicine is like the guy here on the motorbike who's wearing protective gear all over. You never know what's going to happen to you and where it's going to hit. So you need to be wearing protective gear all over. We will underline this in the near future with huge data of evidence-based medicine. And we will go even further. We will be looking into predictive medicine, and not as we have it here, but rather as we have it here. For 70 euros or $80, you can get your genotype transcribed, and you will be able, or you are already able, to understand your susceptibility to certain kinds of diseases. Of course, it's still under negotiation whether these data are correct to 100% extent, but yet a lot of people do already resort to that without consulting their physicians. So we are looking into emergence-based medicine. Emergent is the philosophic term for a flock of birds or a school of fish just, organizing itself. So we're generating more and more data by the day in order to get into predictive medicine. And ultimately, we will be ending up into preemptive medicine. So we will know where disease is going to strike in 10 or 20 years from now. And we will try to figure out whether we should be put on a diet or not in order to prevent this disease, or whether we should proceed another lifestyle. I have depicted Angelina Jolie here. She had the notion that she was at high risk for developing a certain kind of breast cancer, and she had taken the conscious decision to have both breasts amputated. This is empowerment-based or enlightenment-based medicine that we will be seeing in the next couple of years. The borders are really blurry. In the old days, there was bad industry, good doctor, good insurance company. Now it's all blurry. You see the clone warrior here. This guy after duty goes home and is petting his guinea pig. So there's also something nice about a clone warrior, obviously. So we're looking at disruptive times in medicine. We're looking into new players in the field of medicine getting engaged, like Apple and Google and Microsoft. Some of them already parting again from medicine, some players starting into medicine. We look at a plethora of startup companies who try to seek opportunity in the ever-growing healthcare market. These are interesting times. And empowerment is most likely not what you see here. This is a Russian doctor who in 1963 performed an auto-appendectomy in the Arctic realm. He knew he would be dying, so he resorted to cut his appendix out himself. This is not what I consider empowerment-based medicine. This is what happens when physicians get sick. And also, this is most likely not empowerment-based medicine for patients to use a DIY kit in order to perform any kind of operations on themselves. Rather, this is empowerment-based medicine, urging, as a patient, your physician to listen to you, taking the time from your physician, not being afraid of bothering the physician. You are not bothering the physician. You are, as a patient, the mere reason for the physician to have opened up his office in the first place. So patients will be empowered by law. They will be empowered by themselves and by the force of market, because the market is not waiting on the highly regulated sick funds and healthcare market to follow up. The market is developing itself at its own pace. And don't be led astray. Don't be, rest assured, empowerment does not mean obedience. So the empowered patient is not somebody who says yes and amen, great, thank you. The empowered patient will engage into discussion with physicians. And this will be a thing how to measure physicians. Physicians will need to engage with patients on a different level than they usually do right now when they see a patient for like 5 minutes in their office. And you have to think about this. In 99% of the day, you are empowered. You take decisions on business, on politics, on child education, you have it. There's 1% that you still have to seek empowerment as a patient in cooperation with your physician. This brings me back to the beginning. In 1989, on October 16th, 1989, this picture was shot. And this was the first time when the famous exclamation was heard on the streets of Leipzig. We are the people. I think this is a good place to start another, reformation. I already said it. Yes, we are the people, but at one point in time, we will all be the patients. Thank you very much.